February is Black History Month. Throughout the month, Masonicare is spotlighting the achievements of pioneering Black clinicians and healthcare professionals who advanced medicine and race relations in the United States. Before entering politics, Dr. Ben Carson was one of the youngest physicians to direct pediatric neurosurgery at Baltimore-based Johns Hopkins Hospital. In 1987, Dr. Carson became the first neurosurgeon to successfully separate conjoined twins attached at the back of the head. In 1996, Dr. Donna Christensen became the first female physician to win election to the U.S. House of Representatives. She was also the first woman to represent the U.S. Virgin Islands. The Congresswoman was a member of the Congressional Black Caucus and led the caucus's efforts to advocate for minority health issues. At a time when women, regardless of race, were largely barred from secondary education or higher learning opportunities, Rebecca Crumpler became the first Black woman to earn a medical degree from a U.S. college. A former nurse, Dr. Crumpler graduated from New England Female Medical College in Boston in 1864 and spent her career caring for poor women and children. In 1883, she published a book that drew from her clinical experiences to help women better care for the health of their families. As a young doctor in Chicago in the 1930s, Dr. Helen Dickens treated patients with tuberculosis in impoverished communities. Dr. Dickens had been the only Black woman in her graduating class at the University of Illinois. She would go on to become the first Black woman to receive board certification in obstetrics and gynecology and the first admitted as a fellow of the American College of Surgeons. Credited as the father of the modern blood bank, Dr. Charles Drew pioneered the use of blood plasma to store blood for transfusion. Dr. Drew organized the first large-scale blood bank in the U.S. during World War II. During and after the war, he was critical of policies that required blood of African Americans be segregated. Dr. Drew went on to become chief surgeon at Freedman's Hospital in Washington, D.C., which we know today as Howard University Hospital, and the first Black examiner for the American Board of Surgery. Stay tuned for more as Masonicare honors Black healthcare pioneers.